Hello everyone and welcome to another lecture of the AMC preparation course. Today we will speak about the secondary skill lesions. So, the first one is the scale. Scale is a thickened stratum corneum. Scales are flaky, dry, and usually whitish. In contrast, crusts are more often moist and yellowish or brown. For example, it's seen in a couple of conditions like psoriasis, eczema, squamous cell carcinoma, and ichthyosis vulgaris. So we'll take ichthyosis vulgaris for example. So as we can see for at the beginning, as we can see here, we can see the stratum corneum, which is the first layer of the epidermis, and we see that this thickened. So this is the ichthyosis vulgaris. We can see its shape, brown. It's like the fish scales. This is the fish scales, if you don't know. So it's give us the same shape and it's brown. This is another condition. It's not as clear as the first one, but we can also see the fish scales appearance. And it's brown, but the skin color will give us different result, but we can see it also here. For example, also psoriasis. This is the scalp psoriasis. It's also a example for a scale. The second one is the crust. It's dried exudates, such as pus or blood. As an example, you can see it in atopic dermatitis or non-bullous impetigo. So this is the crust. It's the exudate that is dried. So this is the ambullous impetigo. We can see it here. This is the crust. It's the exudate that is dried. This is also an example for the impetigo, ambullous impetigo. Also exudate that's dried. Then we will have the fissure. So the fissure is a linear crack through the epidermis that extend into the dermis. So it's with a crack, right? Yes, it's a crack from the epidermis to the dermis. As an example for it is the erosio interdigitalis blastomycetica. It is actually a fungal infection that's caused by Candida albicans, and we can see it in the foot or in the hand. This one is in the foot. Then we will have the ulcer. It's a rounded or irregularly shaped deeper lesion that it's a result of loss of the epidermis and some portions of the dermis. I'm sure everyone knows the ulcer and saw it before. So we will lose some tissue, the epidermis or the dermis. This is an ulcer. This is also an ulcer. Then we'll have an erosion. It's loss of all or portions of the epidermis. So we'll lose some portions of it. For example, we have this condition, herpetic gingivostomatitis. This is another picture of it. We'll have erosions of the gum. Then we will have the excoriation, which is the scratch marks. We'll have abrasion produced by a mechanical force, usually involving the epidermis. So we'll have a mechanical force that will cause a problem in the epidermis. For example, this patient has scabies, so scabies we will have, it's itchy, so he will scratch. So we will have, you see those pink things, it's the scratch marks. Also this kid, he also has scabies and he is scratching it. Necrosis, dead skin tissue. So when we have a death of cells in our body, we have programmed deaths of the cells and unprogrammed. The programmed one we call it apoptosis. It happens because of the life cycle of the cells, but necrosis, it happens because of other factors. It's abnormal death. So as we can see here, we have dead tissue. This is a very good example. We have gangrene, foot gangrene, most likely because of the diabetes, because we will have, what do you call it? Because of we will have some problems in the arteries, it will get narrowed in the diabetes, so we will have this disease. Then we go to the skin atrophy. We'll have thinning of the skin without an inflammation. As we can see in systemic lupus erythematosus, we'll have these lesions on the face. So it's a thin skin. And then we will have a scar. It's composed of a new connective tissue that replaces the lost substance. So scar from after we have some trauma to the skin. Sometimes we have like overgrowth of the scar, which will called keloid. So this is the keloid. We will have a scar, but when we it will get close, we will have an overgrowth of the connective tissue, and it will perform keloid. This is a scar. Everyone has scars. I have a scar. And actually, that's everything for today. This is just a revision. This is the normal skin and all the changes that we will have it here. Thank you so much for watching. I hope you found this lecture useful. And if you like the content, maybe consider commenting. I don't need likes, just tell me if this is useful. Thank you so much. Goodbye. As a good example for it,